We get a weather update at 11 o'clock from the Met Office through to our gritting controller at Newark. He'll relay that message to the four foremen, which I'm one of, and then we relay that down to our crew that we are in charge of. That'll give you the time that we're supposed to be in the yard, the spread rate that we're supposed to be spreading at, and the weather forecast and what they're expecting and what time we're going out due to the weather. We go out with a said lorry full of salt, could be up to 10-12 tonnes on the back, and away you go. You spread it down, and you want to be putting it down a couple of hours at least before the forecast if it's going to drop cold, to help the traffic crush it down into the tarmac. And then hopefully when it goes freezing, it'll not freeze, it just moistens it up again nicely. It's all down to the weight of the traffic and everything else. It's quite a pleasure to be out there. You know you're doing the best that you can. You're putting the salt out there. You're trying to make the roads safe. You're just in your own little world. You know what you've got to do. You put the radio on, heater's nice and warm, and you're away and enjoying it, and off you go. It's peaceful.
This winter, more than ever, with COVID-19 still circulating, we need help to reduce all avoidable risks. You can help protect the NHS, social care and loved ones by getting the flu vaccine. You may be eligible for the free vaccine at your GP or local pharmacy if you are over 65, pregnant or have a long-term condition. Find out if you are eligible at nhs.uk/staywell. Children up to year 7 can get the free nasal spray at school or through their GP if they are below school age. If you are not eligible for the free vaccine, you can pay for it at your local pharmacy. The flu vaccination does not give you flu. It reduces the risk of catching flu, as well as spreading it to others. If you had the vaccination in the past, that will not protect you as the flu strain changes every year, so you need to have a new one this year. It is also important to wash your hands often with warm water and soap. Use tissues when you cough or sneeze, and bin used tissues as quickly as possible. Thank you for helping to protect yourself and loved ones this winter.
The 3 words I'd use to describe my role is team, rewarding and challenging.
Positive, team, supportive.
3 words I'd use to describe this job: gratifying, inspirational, challenging. Before this, I was a hairdresser, but I wanted to do more than make people feel good. I wanted to help change their lives. I'm now part of a team that does exactly that every day.
I spend my days talking to the residents of Nottinghamshire, their families and the support services that help them on a day-to-day basis. We're the front door to adult social care in Nottinghamshire, and we're responsible for taking the time to build a picture through talking with our residents about how they lead their lives, the things that they find difficult, the things that they can do, and also looking at how they wish to fulfil their lives to the best of their possibilities. In the 5 years of working here, I've learnt so much, particularly about social care. I had no previous experience in it, but through a really good training and induction plan, I was given all of the skills and information that I needed to be able to do my job. I've also been able to grow personally and within my career since then through a personally tailored plan of support and training to keep me going.
We're a really close-knit team and we thrive off helping the community of Nottinghamshire to live a valued and independent lifestyle. Every day is different and there's always new things to learn, which makes the role interesting and really exciting. At the end of the day, knowing that I've helped a number of people to have a better quality of life makes every day worthwhile.
This winter, more than ever, with COVID-19 still circulating, we need help to reduce all avoidable risks. You can help protect the NHS, social care and loved ones by getting the flu vaccine. You may be eligible for the free vaccine at your GP or local pharmacy if you are over 65, pregnant or have a long-term condition. Find out if you are eligible at nhs.uk/stay well. Children up to Year 7 can get the free nasal spray at school or through their GP if they are below school age. If you are not eligible for the free vaccine, you can pay for it at your local pharmacy. The flu vaccination does not give you flu. It reduces the risk of catching flu, as well as spreading it to others. If you had the vaccination in the past, that will not protect you as the flu strain changes every year, so you need to have a new one this year. It is also important to wash your hands often with warm water and soap. Use tissues when you cough or sneeze, and bin used tissues as quickly as possible. Thank you for helping to protect yourself and loved ones this winter.
Okay, so I'd like to thank you all officially to this COVID-19 Resilience, Recovery and Renewal meeting. It is being held remotely, obviously, but it is being recorded for publication. So for the benefit of people who are not actually on these in the meeting and are watching it on the live stream, I'd like Joe, who's the clerk of the committee, to list the members and officers in attendance today. Joe, if you don't mind.
Today are councillors Joyce Bosniak, Roger Dare, Ben Bradley, Kay Cutts, Stephen Garner, Michael Payne, Alan Rhodes and Jason Zadrozny. And as well as myself, we also have the following officers present. We've got the Chief Executive Anthony May, Corporate Director Place Adrian Smith, Consultant in Public Health Dawn Jenkin, Service Director Derek Hickton and Service Director Matthew Neal. We also have some other visitors today. We have Rosa Howie, who is the Programme Director for the COVID response for the City and County. Professor Nigel Wright, Deputy Vice-Chancellor Research and Enterprise at Nottingham Trent University. Professor Sarah Spate, who's Pro-Vice-Chancellor for Education and Student Experience at the University of Nottingham. Jason Carter, the Director of Governance and Assurance for the University of Nottingham. And Sarah Carter, Nottingham and Nottinghamshire's Clinical Commissioning Group.
Thank you very much, Joe. And I think Andy Haynes is also going to be there helping or advising as well on the items that Sarah Carter is going to be talking about. Before we start, I'm glad to see everybody here and we're all healthy. Unfortunately, every time I seem to chair one of these meetings, I have to tell you that somebody else has come down with COVID. And I'm afraid that's the case again with Jonathan Gribben, who I'm sure you all know, a senior officer in public health. I'm afraid Jonathan has also come down with COVID. Anthony spoke to him, I think, over the weekend, and obviously he's under the weather. But I'm sure you join with me in wishing Jonathan all the best. It's not anything that anybody wants to go through. So, having said all that, it's good to see you all here. So first of all, let's go on to the preamble. The minutes of the last meeting on the 3rd of November, can we accept these as true and accurate record, please? Thank you very much. Apologies for absence then, Joe.
We have all members with us for today's meeting, Mr. Chairman.
Okay, thank you very much, Joe. And any declarations of interest from anybody, please? Were you indicating, Alan, or were you just... No?
No, sorry, I was just fidgeting the chair, sorry.
No, that's okay. No declarations of interest. So we're going to agenda item 4, which is the COVID renewal at Nottingham University. I'm really pleased that we've got 2 senior members of our 2 premier learning establishments here with us today. We did ask, I think we talked about it at the last meeting, it would be interesting to get a perspective from them, and I know members have got questions that they might want to ask, so I'd like to introduce Nigel and Sarah and hand it over to them. I think they may have a presentation, is that correct?
I'll hand over to Sarah first, and then I'll follow up with anything that's particular to Nottingham Trent.
Thank you very much, Sarah.
Thank you, Chairman. Thank you, Nigel. We have a paper that I think was submitted to the committee previously, so you'll have that fairly short overview of all of the work that the universities are doing. I think I'd just like to stress that obviously we've been following very closely the government and the Department for Education guidance. And so we, before Christmas and then immediately after Christmas, we will have rapidly adjusted our phasing of our plans for the return of our students to face-to-face teaching. And so as of early January, we will have recalibrated to facilitate the return to face-to-face teaching or clinical placements or social work and teaching placements for that proportion of our students who are covered by the DFE list of exempt courses. So that will have all happened at the beginning of January, and those students will have returned and duly gone into the activities that they were expected to go into before Christmas. And then for both universities, the bulk of our students will have resumed their online digital teaching or their online digital assessments. So certainly at the University of Nottingham, our main assessment period started on January the 11th. So we're now in week 3 of a major phase of online exams. And so, the vast bulk of our students are doing those from home. What we are doing on our campuses, obviously, we are maintaining our essential services for those students who have returned because they're on exempt courses, and therefore we'd expect them to be accessing libraries and study facilities, but also that smaller group of students who are simply not able to study from home and so have come back to university and again are sitting their online exams, but are sitting them from university premises, either from their rooms in their halls of residence or from our study spaces in our libraries. So you might say the kind of university, the education business is continuing according to a set plan. And obviously we've got all our contingency plans in place for as and when we are allowed and enabled to bring back a further tranche of students. And we are expecting a review point from the Department for Education no earlier than the middle of February. And obviously that review point will be taking into account the course of the pandemic, any kind of new strains, and the success of the university testing regimes. So all of that will be taken into account before we would be sanctioned to allow any further returns. And those further returns we were expecting, they will also be phased. So it wouldn't be a big bang. It would be a number of weeks over which we would be kind of directed to bring back further students according to the next group of priority areas. For example, science lab subjects before some others. Nigel, is there anything you would like to add from a Nottingham Trent perspective?
You're on mute, Nigel.
My apologies. Just a couple of things to amplify. We made some rapid adjustments over the break between Christmas and New Year with the new guidance, and that has gone reasonably well. We moved pretty quickly. And we've taken a broadly similar approach to the University of Nottingham. Our student body probably has a slightly higher proportion of students that live locally. Some of those in a family home and they commute in, but for some of our students, their university accommodation is their only place of residence. It is their home. And so we've been supporting those students very, as well as we can over the break and continuing now. But I don't think there's much else to add. Very happy to take questions, which will take us in the direction that members are interested in.
Yeah, thank you very much, Nigel and Sarah, for that. I'm going to open this up to members for questions and comments. So has anybody any questions or comments to either of the speakers we've just been speaking to? Alan.
Thank you, Chair, and thank you to Sarah and Nigel for coming along today and talking to us. It's very much appreciated. And thank you for the information that you've given to us as well. Just sorry to be negative, but you've addressed it at paragraph 11 on page 2 of your report to us about the behaviour of a minority of students before the Christmas break, leading up to the Christmas break, where clearly some students were not behaving within the guidelines given to us by the government, the COVID guidelines. And I see there that you allude to it. What advice and information will you be imparting to the student population when they do return to the two campuses?
If I pick that one up first, I mean, similar to what we were doing before, and even before the summer, we were communicating with our students and indicating that they needed to follow whatever guidance was in place. That was amplified in September. And I think, as you say, the majority did follow that, and the publicity around some of the breaches it was unfortunate that the breaches took place, but the publicity sometimes did help to emphasise to the students the seriousness with which the universities and the broader community and authorities took those breaches. So we will be amplifying that again to our students when they return, because of those, it's a minority, but some of those incidents were quite egregious.
Thank you.
Yes, and so again, to echo that from Nottingham, and I'll just put my colleague Jason Carter on standby because he may want to add a little bit more detail in a moment. We have been doing things like, fast tracking our disciplinary procedures so we can very, very quickly discipline students on breaches, keeping a very close eye and looking at where are the kind of the challenging areas. Is it late at night in social settings? Has there been some poor behaviour in buildings during the day? For instance, where we're picking up poor behaviour in buildings during the day, for example, in libraries, then we're taking a firmer approach, and rather than giving a couple of warnings, we're kind of, let's say, banning students from particular buildings for a set period of time to try and get the message very, very clearly across. And also making it clear to students that poor behaviour at the moment potentially is putting at risk their assessments. So that's, it's quite a big risk there to themselves and their peers. I wonder if Jason would like to add anything about the specific measures that we've been trying to just kind of step up on campus.
Thanks, Sarah. Yeah, I would just add that in addition to that, we are bringing in more resources to help us ensure compliance within the campus region as well. So we've recruited some more security staff who will be making sure that those standards are implemented continuously now as we progress through this semester, because we do recognise the seriousness of this.
Yeah. I think.
Sorry, Councillor, can I just add one more? Sorry, I beg your pardon. If I can just add one more comment. We do, of course, have our students are very, very helpful in this, because the vast majority of students at Nottingham Trent and University of Nottingham, they themselves are uncomfortable when they see a small minority of students not adhering to the guidelines or the rules. And so obviously the vast majority of our student population are very, very supportive and working with the universities to try and get over those messages of good behaviour to their peers.
Yeah,
it's very helpful from my perspective, Chairman. Thank you.
Yeah, I think it was a good question, Alan. I think that all of us are on your side. We want to see both universities do really well. Some of us were students ourselves. We know what it's like, or can vaguely remember being 18, 19, and we're not trying to take that joy away from coming somewhere new and living life. But it is important, I think, that the publicity doesn't go too negative. And this is the first time I think you've articulated that there is a disciplinary procedure in place for those people who deliberately actually just say, you know what, I don't care about my fellow students, or I don't care about the population of Nottinghamshire. I don't think that was got over enough, and I'm glad that you've brought that up, that disciplinary process. So there's a strict process that if these people continued doing this, that ultimately they run the risk of being sent down. Michael, did you want to say something?
Yeah, thank you, Chair, and thank you to Professor Wright and to Sarah as well. Thank you very much for the presentation. Very interesting. Just two questions, really, I guess, in relation to student welfare. The students are a critical part of the community in Nottinghamshire and Nottingham, and I really welcome the elucidation about the contribution that students have made to the wider community in the response during COVID, and they should be commended for the excellent work they've been doing to support vulnerable people. I think it's absolutely superb, and I think sets against some of the more negative criticism I think that we saw in the national press around students. Just two questions, if Professor Wright and Sarah could elaborate for us on what response the university are providing in relation to the impact of mental health on students. Clearly, we know that there is a big impact on our own communities in terms of mental health with this third national lockdown, and we know that there's an impact on students as well, particularly where students perhaps are feeling more isolated than perhaps they would ordinarily in terms of being able to socialise with their friends, etc., under normal circumstances. And I guess just linked to that, John, we know in our own communities that COVID has been hugely detrimental to vulnerable families and put people in real difficulty in terms of finance. And we know that surveys recently have shown that 2/3 of students are having to now live at home with their parents, not using the expensive accommodation they pay for, are having to draw down on financial contributions from the parents, perhaps never being able to pay that money back, given the other financial pressures on them. So I just wondered what the universities were doing around support in terms of mental health and financial support for our students, under the context of the fact that obviously they are a key and integral part of our community and economy here in Nottinghamshire and Nottingham.
Yeah, thank you for that. There are a number of points I mentioned that might be useful in answering that question. First of all, obviously there is a concern with students that they're paying rent for accommodation that they can't use. So at Nottingham Trent, we've agreed that for all the accommodation that we own and where we recruit the students into the accommodation for the period of this current lockdown, we won't be charging them rent. And I know the University of Nottingham has done something similar, which I won't try and describe because Jason and Sarah will do it more accurately than I would. And we're also pressuring the private providers to take a similar approach. And some have done, and some did last summer, but not all do. And we're continuing to pursue that. A lot of our students are affected because they work during their studies to help support them. And that's often in the hospitality industry, and that's not there for them either, so that's difficult. We have been supporting students, specifically those who are self-isolating. So we've had a reporting system where they let us know that they're self-isolating either because of infection or because they've been in contact with somebody who is. And we in the more acute phase, we were providing hot food and food parcels, and checking in with them to make sure they're okay. We also had a process in the earlier part of the last term where if we didn't get the impression that students were engaging, and that's either through in-person teaching or we can work this out through their, we know when they've been in the library because they use a swipe card. We were actually phoning up some of the students that didn't seem to be engaging just to see what the problem was. And most of them welcomed that, and the response was, well, it's not good, but I'm okay. And they've probably engaged a bit more after that. And for some, it was more acute, and we put them directly in touch with mental health services. Broadly, I mean, it's not just those self-isolating who are impacted, students more broadly are impacted. So we've put more resource into our mental health support. And we also have a hardship fund that students can apply to if they've got particular problems. And there is a fund of money we have from the government, which is about widening participation in universities, but a lot of those events we couldn't do. So we got permission from the Office for Students to use that money for student hardship. So that was very helpful. So there's a broad range of things there.
And so I can echo everything that Nigel has said. At NTU, there's a mirror activity approach that's being taken by UON. And perhaps just to expand on our approach, so as we think of our support for our students in kind of three strands, there's the welfare, the pastoral, and the academic. And we're trying to support their mental health through all three of those. So in terms of the welfare, yes, there is the counselling service, there is the mental health first aid service, there are the wellbeing officers that work in all of the work with the academic schools, and we also have an online service that we've subscribed to support us through the pandemic called Together All, which is well used within the sector, and that enables actually staff as well as students to access kind of peer support. And there's a whole range of kind of online resources too. So we've kind of put more resource into that. And we also have kind of monitoring usage and take up so that we can scale up and put in additional staff resource as and when we need it, according to the demand and how well those services are being used. So that's the kind of some of the welfare around mental health. And then pastoral, in terms of the pastoral strand, every student at the university has a personal tutor. Now, those personal tutors tend to be academic members of staff. So for me, for example, I might have 10, 15 students who I have a direct connection with, and part of my job is to reach out to those students on a regular basis, so to check in with them. And so we increased the number of times this year that we expected personal tutors to make those contacts. And the personal tutor isn't the mental health expert, they're the triage. They're able to signpost, they're able to flag if they feel that there's an issue and that student isn't accessing support that is available to them through the university. So the welfare, you might say, is led by our professional service colleagues. The pastoral is led by academic colleagues. And then, of course, we've got the academic teaching, through which we are also checking up. We're looking at, as Nigel said, who's engaging, who's not, who's missing out on all of their opportunities to attend their online lectures. And therefore, we're able to flag that, go back to them and say, have you got a problem? Is there an issue? Is there something that we can help you with? So kind of all of that is kind of quite well developed now. And just to add that, obviously, we're also working very much in partnership with our students' unions, who, of course, are incredibly committed to supporting student mental health. So one of the University of Nottingham flavours of that is our students' union launched a kind of reach out kind of campaign a few months ago now, which was again about encouraging students to reach out to their peers, because we know that what students are really missing are those opportunities to create those friendship groups, both for study but also obviously for general support through their student experience. So very much a partnership approach between all dimensions of the students' union and the universities.
Thank you. Thanks for that, Mike. That was a great question. Joyce, I've got you next.
Yeah, okay. I'm really delighted to hear about the level of support that you're giving to students. And I'd also like to also say that I know that our students are getting a bad press at the moment, and I'm also pleased to know that our students, the vast majority of our students, feel quite aggrieved with that because they're all getting tarred with the same brush. So I do feel more comforted after hearing what you've had to say there. My question is one that you probably can't answer. And that is about what scope is there within the government guidelines that you have to look at the possibility of vaccinations for either students or staff within the two universities?
I think when it comes, we've clearly been running testing in the universities, and we've been speaking to the CCG about ways in which we could actually provide space to help with vaccination of the wider population. I think with students and staff, we would expect in the prioritisation that's been made for them to be prioritised appropriately through that. If public, and we really follow the guidance of public health as to whether it would be necessary to vaccinate students as a group, and we haven't had that advice yet. And in terms of our staff, the rate of infection has been relatively low. And we've not got any evidence that there's been transmission in the in-person teaching environment. So I'm very keen to protect our students and staff, but I do feel there are other groups in society who I think are appropriately prioritised ahead of students and staff.
Yeah. Thank you very much. Thanks for that, Joyce. I think that's been an excellent debate, and the reason I asked for senior members from the universities to come and speak to us, because as has been highlighted by Joyce and Michael, it's very easy when you're facing a public health crisis like this to look for scapegoats, and unfortunately I felt that it was almost as if students were filling that vacuum. Now, as Michael has highlighted, there have been problems, but the vast majority of students from both the university and Trent not only make a massive difference to the economy of the city, they also work in the social sphere and in welfare as well. So we, on behalf of the members, I'm sure you agree with me, I'd like you to thank the students who do a tremendous job. I don't believe that we need any other information from you. The actual, if you look on page 6, we have to take a vote on whether or not we're happy with what's the information that's been provided. And unless anybody disagrees with me, I think the members who have spoke to us today have given a good account for themselves. Michael, is that a legacy hand, or do you want to ask a question?
I just very briefly wanted to say to both Professor Spate and Professor Wright on behalf of the committee a thank you to the institutions for the research you're doing around COVID as well. Clearly the scientific response and the educational response to this pandemic has been outstanding and led by our education institutions, and it's reason if ever for us as a community to make sure that we argue in public policy to make sure that you're appropriately funded going forward. I know there will be some challenges in relation to the changes of arrangements around our relationship with Europe, etc. on research, but I think you should be commended for the outstanding work I know both institutions are doing around the research in this area. It's benefiting everybody across the society and proves that we're still one of the world leaders in terms of higher education. I know that Nottingham and Nottingham Trent are at the forefront of that.
Yeah, thank you, Michael. That's excellent. Anybody else? Before I wind this up, we do have to take a vote there. So is everybody happy with my suggestion that we've actually got enough information from the representatives of the two institutions and we don't need any more as of yet?
Absolutely, Chair.
Okay, thank you very much. So we do have to take a vote though, I'm afraid. So Joe, would you like to call the register, please?
Before we take the roll call vote, Chairman, are we able to confirm who's seconding that, please?
Oh, sorry, I beg your pardon. Reg?
Yeah, I second the motion and reserve the right to speak on it, but we've already spoken, so I don't need to say any more.
Thank you for that, Reg. Thank you very much. Joe, would you like to record the votes then, please?
Thank you. And just to confirm, while we're taking votes by roll call today, they won't be recorded in the minutes unless 2 or more members request it in line with the Council's usual recorded vote arrangements. So Councillor Adair.
4.
Councillor Bosniak.
4.
Bradley.
4.
Councillor Cook.
4.
Councillor Garner.
4.
Councillor Knight.
4.
Councillor Payne.
4.
Councillor Rhodes.
4.
And Councillor Zadrozny.
4.
Thank you. That's carried unanimously.
Thank you very much, and can I thank you once again, Nigel, Sarah and Jason, for attending this morning. We really appreciate that, and we'll let you get on with your day now. Thank you very much.
Thank you very much.
Thank you.
Okay. So we're on to the next agenda item, which is the agenda item 5, COVID situational update. And we're going to, Sarah, you're going to deal with this, I think. Is that correct?
No, Chair. To start us off, we'll have Dawn Jenkins from Public Health and then Sarah.
Yeah, beg your pardon. Dawn, sorry, I'm preempting you.
Thank you, Chair, and good morning. It's Dawn Jenkins, Consultant in Public Health for Nottinghamshire County Council. In a moment, Chair, I'll bring up 2 slides, if I may, to support the situational update. If you'll just bear with me with the technology as I bring those slides up. And if Chair, you wouldn't mind confirming if you can see those slides on the screen at this time.
I can. Thank you very much.
Thank you. Thank you. Good morning, everyone. I'm providing you with a brief update on the COVID situation in terms of case rates in Nottinghamshire this morning. As you can see on your screen, covering the 7 days within the relevant range, which is, I think, bear with me, the 11th to the 17th of January, excuse me. Pleased to say that we are now seeing a levelling off and a decreasing of case incidents across Nottinghamshire. It's not falling as quickly as we would like, clearly, but we are seeing that as a gradual levelling off and, in fact, decreasing. The transmission continues to be driven in large part by the working age 18 to 59-year-old age groups. You will see in the slide on your screen the highest rates continue to be in that age group, with the lowest rates being in children aged 0 to 17. If I continue on to my second slide, this provides us with a breakdown of the rates across Nottinghamshire. What we see is that there is a high degree of variation in rates across Nottinghamshire. Highest rates continue to be seen in Mansfield and Ashfield. And in fact, those rates are still trending, plateauing or trending slightly upwards in some places in Mansfield and Ashfield, with lowest rates being seen in Bassett Law. We continue to see high levels of positivity again in Mansfield and Ashfield, and in some places in Mansfield and Ashfield, higher levels of case rates within the over 60s age group in particular. But I guess, as I said, the overall message being that we're now starting to see a decrease in rates and a plateauing and a decrease in rates. Within the 7 days that are being referenced in these slides, there were 3,070 cases across the whole of Nottinghamshire. Also, just to mention that with the exception of Mansfield and Ashfield, all other areas are below the national average. Mansfield and Ashfield fall above the national average, but they are not within the top 25% of case rates across the country. Thank you. I'll pause there in that update, and if I may, Chair, hand on to Sarah Carter to provide the vaccination update.
Sure. Sarah?
Thank you, Chair. I'll start by saying, just giving you a bit of a refresher and an update on the headlines of the vaccination programme. So we have our hospital hubs. Vaccinations began at the 2 hospital hubs at Queen's Medical Centre and Kingsmill Hospital in early December. The hospital hub sites have now been joined by a further site at City Hospital, and frontline staff across health and care are being vaccinated additionally at Bassetlaw Hospital. We have 6 local vaccination services across the county that are open and operating, with staff working very hard to vaccinate those who've been prioritised by the JCVI. The 6 sites are at Ashfield Health Village, the Richard Herod Leisure Centre, Gamston Community Centre, Cripps Medical Centre, Kings Meadow and Forest Rec. And there are additional 3 primary care network sites in Bassetlaw, at Newgate Street, Retford Hospital and Kilton Forest Community Centre. Today we opened the site at Mansfield, which is our largest vaccination site in Nottinghamshire, following a soft launch at the weekend. The programme has really ramped up over the last 10 days, with a focus on ensuring care homes for the over 65s and the over 80s are vaccinated. There's been a significant mobilisation across all partners, and it's been a big effort, and certainly the largest effort that any of us have collectively seen. Staff are working 7 days a week, 12 hours a day, to ensure that the capacity is there to deliver against our vaccine supply. Primary care general practice has supported the care homes vaccination programme over Friday and Saturday and Sunday of this week as a large part of a roving service, and this has led to a significant improvement in achieving the targets. I can't advise today of exact figures as they're being validated, Chair, but I will certainly advise you of them as soon as we know what they are. Our 6 local vaccination service sites continue to operate as mentioned previously, and we're joined today with the formal opening of the vaccination service in Mansfield. We are experiencing a high take-up at all of the sites and very low non-attendance. Hospital hubs continue to focus on workforce vaccination, whilst continuing to also vaccinate over 80s who are already booked in. From a JCVI cohort perspective, all over 80s have received their letter by Tuesday of last week. And last week we also officially published the booking website and phone line to support those residents whose letters may have gone astray. We're on target to deliver all care home and over 80s by the end of January, with a real push this week involving GPs, as mentioned previously. The invitation letters to the over 75s have started to be distributed. The over 75s can now book a vaccination appointment using the details in their letter or the link that's been shared. The target is to have vaccinated all over 70s health and care staff, the clinically extremely vulnerable and care homes by mid-February, which in Nottingham and Nottinghamshire will mean the delivery of over 270,000 vaccinations. You may be aware that bookings for the over 75s were paused on Friday as a result of vaccine supply issues. But from an assurance perspective, this was resolved by lunchtime on Saturday, and vaccination appointments were stood up for the over 75s across the system. We will be sending out the 70 to 74 letters next in our next cohort, but we are using this time this week to ensure that the over 75s have the opportunity to book themselves in for an appointment. There's been some understandable confusion about the national invite letters and the local invitation letters, and a social media graphic that helps to explain that, and that I think may be useful for you, has been developed, and I'll post that into the chat box at the end of this, to ensure also that those in the vulnerable groups or who are geographically or socially isolated can access community vaccination services as soon as possible. The vaccination programme's made provision for a limited supply of transport to those who meet the eligibility criteria. That will be provided by volunteer drivers and taxis, and those who need to use the service will be able to request this at the time of booking their appointment. And again, I will attach a simple guide to transport for those individuals into the chat. From the 21st of January and weekly thereafter, the data released regarding performance will be centrally held on the NHS website and will include vaccination data in more detail. That means that you'll be able to see the number of vaccinations administered to our population, including the detail of the over 80s vaccination rate and some more detailed demographic information this week, we expect. From a plan perspective, supply allowing, we expect to have vaccinated the 5,080 plus housebound individuals in the week, and we hope to have completed vaccination in the 80 plus cohort by the end of this month. Letters, as mentioned previously, should all have been received by the current cohorts, and then there has been a booking link published for anyone who's not received the letter. We're on target to deliver the first vaccine to the cohorts 1 to 4, as set by the national deadline of the 14th of February. Notts County Council have now commenced a public inquiry line through their customer service hub for members of the public who've got a general inquiry about the vaccine, and that has been an incredibly supportive move by the County Council. I'll pause there, Chair, if that's okay, and see if there are any questions.
Yeah, thank you, Sarah. Thank you, Dawn. I've got several people who are indicating they want to ask questions, but before I move on to open it up to debate, I'm going to move formally the recommendations on page 10. I need a seconder for that, please.
I second that and reserve my right.
Thank you very much, Reg. So I've got Joyce, Ben, and then Alan, please.
Right. My question was for Dawn particularly, although I was really interested in what you had to say, Sarah, about the rollout of vaccinations and for the information you've given as well. So rather than ask the question here, I get on the website and find out for myself. So I'm really grateful for that. Dawn, I know you're working with figures to the 17th of January and they seem relatively stable or just going down, but we all know that nationally that the figures have increased rapidly within the last few days. So I can't really believe that those figures actually are anywhere near the reality figures. And I know it's difficult for you to say because of the information you're given, but the data you have is already 8 days old. And we know nationally there's been a really high peak, a rapid increase. I can't believe that hasn't been reflected across Nottinghamshire, and particularly Mansfield and Ashfield, as you said, were already very problematic. That's my question.
Thank you, Joyce. I'll take them in the order I've just asked, and then ask you to come back. So Ben, and then Alan, please.
Thanks, Chair. I'm not sure that's right about cases rising recently. The last figures I'm looking at in front of me are from the 24th, which show a 22% reduction in positive cases. But I'm sure they'll come back on that. I'm sure Dawn can do that. I had a couple of questions. One around, obviously, we talk a lot about the case rates. I think as we roll out vaccinations and we look at further down the track, when are we going to be able to start to lift some lockdown restrictions, which are on a lot of people's minds. The perhaps more prevalent discussion is around serious illness, hospitalisations and deaths in particular. I wonder if there's any figures on that, because nationally it seems like those figures haven't yet caught up with the falling rates of positive tests, and we obviously need to make sure that falling levels of transmission leads to falling levels of NHS pressures, etc. So I wonder if there's any of those figures available locally. And the second thing to Sarah on the vaccines, obviously you sort of ramped up a lot over the last 10 days. Unfortunately, we saw the figures last week that said Nottinghamshire was pretty low in the national table in terms of numbers. Good that you think we're on track to get it done by the kind of deadline that's been set, but are you confident that we are catching up from that perspective? So that's really important for residents' perceptions. And what has been the challenge? Obviously, logistical challenges in terms of getting things open, but has there been a specific problem? Is it vaccine supply? Why is it that we're down that wrong end of the table?
Alan, I'll come back to you if you don't mind. I'll let them deal with those two questions first, then ask yours. So Dawn and Sarah, do you want to deal with the issues that have been raised by Joyce and Ben there?
Thank you, Chair. Yes, just firstly, in terms of Councillor Bosniak's question about the most recent data and are we seeing a spike. So the data I've presented to you is the data that we call sort of the complete data in the safe window that we know all the data's in for. The most recent data we have access to internally, which is not yet sort of final data, still continues to show that that plateauing and that downward trend in rates across Nottinghamshire. So we have seen a rapid spike, particularly in Ashfield and Mansfield in the most recent weeks, but we are now seeing across across the county, that gradual turning of the curve and a downward trend. That's not to obviously preempt that the direction could at any point change, as we may see new outbreaks or new transmission events, but that's not something that we have any indication of locally at the moment. In terms of the question about,
Dawn, could I just ask then, you have access to the same information that Ben has got, because Ben's already alluded to the fact that he's got information from the 24th. So you will have that, but you'll present it once you have all the information together. Is that what you're saying?
Yep. So we don't tend to present that information because that may change, because you still get more test results, more information back in that window. So we present the window that we are confident won't change in terms of rates. But we do internally every day look at the most recent data, and we keep a close eye on it for all parts of Nottinghamshire every day in our outbreak cell meeting.
Thank you.
To Councillor Bradley's question about serious incidents and hospitalisation, I may ask Sarah if she'd like to comment on the detail of this, as I know she's closer to the Health and Social Care Economy TCG reporting on that. It is true that serious incidents and hospitalisations do tend to trail cases, so we would expect, having now started to see cases turn the curve, that we still will see increases in serious illness and increases in hospitalisation. Those we would expect to continue to increase, unfortunately, for some time still locally in Nottinghamshire. But if I may ask Chair for Sarah Carter to give any comment on that. Thank you.
Thank you, Dawn. Sarah?
Yes, thank you, Chair. Yes, in terms of the NHS system within Nottingham and Nottinghamshire, it is still incredibly pressured, and we expect that we will hit the peak of that probably towards the end of January, early February, and that will be sustained for a few weeks. Ordinarily, what we see is a 6-week lag between improvement in community infection rates and any type of improvement within particularly NHS acute services. So we have general practice fully open under a significant amount of pressure. We have all of our health and social care services operating under a single amount of pressure, but our acute hospitals are still in a state of surge, and we're utilising surge capacity every day to ensure that we can deliver an effective service for those people who've got infection and have been admitted to hospital.
Okay, thank you for that. Alan?
Sorry,
Yes,
sorry, just to interrupt. Sorry, Alan. Just we didn't cover the other part of my question, which was around why our figures were comparatively low compared to the rest of the country.
Thank you. And yes, we had a slow start. We opened 2 hospital hubs at the beginning of December, and our vaccination sites weren't in the cohort that we were being opened in advance of Christmas, and that was a vaccine supply decision made nationally. We were ready to step up our vaccination sites, so we had a slightly slower start. But in answer to the question, am I confident that we have recovered the position? Absolutely, and we will. Now all of our sites have stepped up, and certainly the site at Mansfield will be a game changer in terms of the number of vaccines that can be delivered in Nottinghamshire moving forward. So I am absolutely confident that we will be meeting our targets.
Thank you. Alan?
Yes, thanks, Chair, and thanks to both Dawn and Sarah for coming on this morning to address some of the issues. I'll start by saying I think the rollout of the vaccine programme is very much to be welcomed. It offers hope to people who are so very worried about this horrible virus. So, I'm highly supportive of it. It's not been, obviously, it's a massive programme, and it's not been without its problems. So I wrote to the Director of Public Health last week, before I knew he was ill, actually, to express concern because I'd had a number of complaints about the difficulty that people were experiencing actually phoning up to book their appointment, hanging on the phone all day, not being able to get through, and I don't think that's an acceptable situation. I know that that's now being addressed and that the county council is going to pick up some of that and offer some assistance. I know that from a phone call I've had this morning. I also know that some people are being expected to queue outside at vaccine centres aged 80 plus in January, and that is clearly not acceptable. And that's a situation that I hope will change very quickly, because it's not the service that should be being offered, quite frankly. And I know that that will be something that the NHS will want to address as a matter of urgency. The other issue is an issue that I hope that Dawn will respond to. I think it may be something that's already been alluded to in the questions that both Ben and Joyce have asked. Last night, I was sent a table by somebody that I'd never heard of before on social media called UK COVID-19. England local authorities by highest number of COVID-19 positives per 100,000 population. And it was pointed out to me, Chair, that Bassetlaw had seen a rather sharp spike. Bassetlaw being, as people know, an area that I both live in and represent. And it had seen a rather sharp spike. I'm desperately looking for it on this very complicated list, but I can't find it at this moment in time. So I can't tell you how big the spike was, but it was it was sharp enough for me to respond to the person that sent it to me to say that I'd got this meeting this morning and I'd raise it. Dawn, can you confirm that? And these are results from the 19th of January, which of course is very relatively recent. So can you confirm, Dawn, that there has been a spike in Bassetlaw? And if there has, have we identified where and why that spike's occurred in the number of cases?
Dawn?
Thank you, Councillor Rhodes. I'm not seeing data that reflect a large spike from the 19th within my data around Bassetlaw. There may be some detail to that that I could explore further, but that doesn't concur with what I'm seeing in front of me.
Oh, okay, thanks, Chair.
Anthony may have some information on that, Alan, I think.
Yeah, thank you very much, Councillor Rhodes and Dawn. Can I suggest, Alan, if you've got that data to hand, that you forward it to Dawn so she can check its veracity. We will receive an update of data at some point today, and I'm very happy to summarise that into an email for all members so that county councillors are aware if indeed we are seeing the rates going upwards in any of our districts.
Can I quickly respond to say that this was sent to me on Twitter. It's not been sent to me personally. It was forwarded to me to my Twitter account last night with a question from somebody asking if this is accurate and how and why has there been a spike in Bassetlaw. I mean, clearly I don't know, but I don't have the information in person. If I can suggest that Dawn looks at the UK COVID-19, sorry, at UK COVID-19 stats Twitter site, you may be able to pick that up. It's at UK COVID-19 stats, it's called.
Okay, thank you, Alan. We'll do that.
All
right. Steve Garner, please.
Thanks, Chairman. Well, Alan's stole me thunder on quite a few issues about queuing and etc. But I had a phone call this morning from a lady, and it is concerning. She only has to have the Oxford AstraZeneca vaccine, and she cannot have the other one due to doctor's circumstances. I mean, that's what she told me. And the question is she's rung them up, and they haven't told her where she can get this Oxford one in the Mansfield area. So my question would be do we know where the Oxford's been used and the Pfizer's been used and in different places? Because obviously, you know, you deal with these issues and it's like, well, what can I find out there? You know, so that would be my question: is can we have an update of where the vaccines are going in different sites? Thank you.
Thank you.
Sarah, beg your pardon. Sarah, do you know the answer to that?
I do, yes. Thank you, Councillor Garner. We know exactly where every single vaccine is being delivered across the city and county. It varies because our vaccine supply and the numbers of Pfizer versus AstraZeneca varies in terms of our deliveries, but we know exactly where each of those vaccines are placed. We know every individual who has been vaccinated with Pfizer and every individual that's been vaccinated with AstraZeneca in preparation for second vaccines. And if there is an individual who can only have the AstraZeneca vaccine for due to medical purposes, if that individual, if she phones the booking line will be able to make sure that she's at the right venue to get the AstraZeneca vaccine.
Thank you, Steve. Thank you. And I've got, sorry, did you want to come back, Steve?
Well, I mean, that is the problem. She's rung up the booking line and they can't tell her. So that was the problem. So she sat there. She don't want to be going to King's Mill and thinking, oh, well, I get there and I can't. So that's the problem. The people on the phone have not told her, you know, where to go.
Councillor Garland, could I ask you to share the details of the lady with me offline, and I'll make sure that she gets to the right location.
Thank you.
Thank you.
Yeah, I think there has been an issue, and Alan's alluded to this, that perhaps the customer service has not always been what it should have been, and issues like the one that Stephen has just highlighted have been happening far too often. I'm hoping that now the county council are coming in and taking on board some of that the customer service element of it will get better. That's not to criticise. I'm not criticising what's gone before, but we are learning as we go along. And I think sometimes, as you say, you were left on the line too long, and when you actually got through, you didn't always get the information that you wanted. So hopefully we'll see a forward trajectory from now on. Mike, I've got you. You're the last one to ask a question.
Yeah, thanks, Chair. And let me just say thank you to Dawn and Sarah and all the teams who are vaccinating across the county and city. Clearly, you know, tremendous effort from staff and volunteers. So I just caveat what I'm going to say by saying thank you to the teams because they're doing a superb job. But it is our job as lay elected persons to ask questions to make sure that we can try and improve. And as Councillor Bradley said, there is a lot of public interest in the vaccination rollout for understandable reasons, because for a lot of people it can be an issue between life and death if you are in one of those vulnerable categories, or if you are somebody who's in one of the priority cohorts. I just want to put on record, Anthony, a thank you for the County Council's support, as Councillor Rhodes referred to, in terms of the customer support number. There clearly have been problems. I think Sarah acknowledges this with the phone line. I've certainly picked up a number of constituents who have struggled to get through. 92-year-old partially blind lady who spent a couple of weeks trying to get through. Sarah and her colleagues have assisted, and she is now one of those people who's going to be picked up and transported to the nearby site. So there are systems in place to support those people, but there have been frustrations. I just want to press the question that Councillor Bradley asked and Sarah's response around vaccination sites that were ready to be stood up in mid-December that weren't stood up until partway into the early part of January. And Sarah's, you know, thank you for being transparent, Sarah, issues around a national decision around supply. I just want to understand a bit more about that, because if you stand back and look at those official figures that were published last week in terms of the STP areas, Nottinghamshire's second to worst in England in terms of the first dose, the worst by a country mile, for choice of better words, in terms of second dose. And I understand that the first dose is the priority. The question clearly we then get as elected members from residents is why? Why is Nottinghamshire so far behind? And I totally understand the logistical challenges around this. I absolutely understand the pressure that Sarah and her colleagues are under. So I don't say this to point blame or to criticise. I say it, as Councillor Bradley said, to try and understand genuinely what sits behind this. So if Sarah could just elucidate a little bit more about what does that mean when she says there was a national decision around supply that meant that some of those vaccination centres weren't able to be stood up in the few weeks before when they were ready. Certainly the Richard Herod Centre I know was ready in mid-December, because if it is a national decision by whoever, national NHS or the government, to send supply elsewhere, that is really worrying. And, you know, I think what sits behind Councillor Bradley's question is there's a role for us as elected members, both as county councillors and members of parliament and district councillors, to make sure that our area is receiving, you know, fair treatment, because we're getting questions from residents, rightly, who are concerned about this. So I'd just like to understand a little bit more about that. And myself and Councillor Clark as leader and deputy leader from Gadling have written to Amanda Sullivan and to colleagues in the NHS to say, in the vein of Councillor Bradley's question, are there further things we can be doing as partners to help ramp up that effort so that we don't find ourselves at the tail end of those league tables? And I know league tables aren't the be all and end all, but if you're a lay person watching the news and you see those figures, a very worrying time for people, clearly those figures will worry residents. So I hope Sarah can take those questions in the way in which they're intended. They are not a criticism, but I think if we weren't asking the searching questions as elected members, we wouldn't be doing our job on behalf of the residents that we represent.
Thank you, Councillor Payne, and I absolutely accept the manner in which those questions are asked. I'll start with a couple of the earlier questions, which was the booking line. So the booking line for people to book an appointment was being overwhelmed by people with general inquiries with regard to vaccine and people who were not yet in the cohorts, and this is why we're very grateful that the County Council's customer support line is being made available to us to ensure that actually those individuals who do have an inquiry rather than required to book an appointment are able to do so. I would say the second thing to that is we've increased the number of workforce that are available on the booking line as well. And certainly I've not heard anything, certainly over the last few days, that suggests that that's not working. With regards to the queuing that was mentioned, again, each of our sites has been assessed from a queuing perspective in order to ensure that queues aren't forming outside in the depth of the winter. There are also, we've also addressed that by putting shelters, etc. On sites. What I would say, and one of the things that I think you can help us with, is to try and encourage people not to turn up an hour before their appointments, because that is the experience and that's causing the challenges around the environments not being able to cope with the volume of people who are attending for their appointments much too early. The feedback we're getting from people who are attending the sites is, if you go on time or 5 minutes before your appointment, it's a very, very slick process. You're in, you have your vaccination, you are observed for 15 minutes and then you're out. And certainly I've had feedback about that several times over the weekend, that is the case. But if you turn up early, it's very difficult to accommodate that for those sites. With regard to the second dose, I don't think that's a bad thing at all in terms of second dose. We have been given an absolutely explicit direction that we should not be giving second doses until week 12 after the first vaccination. And that is what we've rigidly stuck to ensure that we can deliver as many first vaccinations to people as we possibly can in Nottingham and Nottinghamshire. It is not something that we would want to be increasing at this stage until those people who have had the first vaccination are 12 weeks down the line, and then I would expect to see that figure increase. So I mean, that's the second dose. With regards to the stepping up of the vaccination sites and the stepping up, actually, we have a forward plan in terms of number of vaccinations delivered on each site, which will really mean that we can meet all of our targets and trajectories now. The thing that I would ask, that you asked what you can do, that would just be to encourage people the minute they hear something in terms of the vaccination invitation letter, please encourage them to contact and book an appointment as early as possible, as soon as they get the letter. That would be the first thing. The second would be to encourage people to, even if they think that transport is a difficulty, to get on the booking line and book an appointment and book transport. It is free of charge, and that's what it's there for. And I would not want people not accessing the transport option in order for them to engage with the COVID vaccination programme. I do think that in terms of us not starting pre-Christmas on the in the community vaccination, local vaccination sites, it did step us back by about 10 days. But actually, now our Wix site has gone online, and now that all of our sites have gone online, I have no doubts that we will be working to the plan that we've had, and we will be getting people vaccinated in a timely manner in line with the national expectation.
Okay, well, I mean, thank you for that. As a committee, we've got something of a dilemma, because obviously we're all extremely proud here of the fact that the United Kingdom is way ahead of the vaccine rollout, way ahead in terms of the developed countries in the world. I mean, we're #1, and I think only a couple of countries like the Seychelles and Bahrain, hardly comparable, are ahead of us, full stop. But without getting too parochial about it, it is slightly unnerving to see Nottinghamshire towards the bottom of those tables. And I know with all tables, somebody's got to go bottom, but I don't want it to be us. Now, I've accepted what you've said. I do share Alan's concern about seeing people queuing in this weather to get the vaccine. There's no point in getting the COVID vaccine if you get double pneumonia going to get it. So I'm hoping that we're going to deal with that. I think Anthony's going to make some comments about that. Before we move on, has anybody else got any other questions that they'd like asking? No? Anthony, did you want to mention something about the
reserve me right?
Yep. Yes. Yep.
Yep. Thank you, Chair. Only a couple of things in supplement to what Sarah has said. So Sarah, Amanda Sullivan and I are in constant contact about how the County Council can help support the rollout of the vaccine. Naturally, members and some members of Parliament have escalated issues to me, either about the way the centres are set up and their access, or people waiting. On all occasions, I've referred those to Sarah and Amanda, including out of hours and across the weekends, and they've been extremely responsive. We'll continue to offer our support to Sarah and Amanda, and I'm really pleased that our Customer Services Centre has been able to help as of today. But Sarah, if there's anything else we can do, then please ask us. Over the weekend, for example, colleagues, we went out and made sure that the car parks and the footways in the vaccination centres were safe, and we continue to prioritise on our gritting routes, the vaccination centres. So anything we can do in addition to that, Sarah, please let us know. And lastly, from me, Chair, I'd like to record my thanks to members of the County Council staff who have been volunteering at the centres in their own time, in evenings and weekends.
That's brilliant, Anthony. Thank you. And yes, we pass on that thanks from the committee members, I'm sure. Anybody else before we move on to the vote? Reg, did you want to say anything?
Yeah, can I just reserve me right, Chairman. So I'd just like to say to Sarah, mainly, I got my letter on Friday for asking me to phone out. And I'll just give you my personal experience, and then other people who then rang me and said, Reg, do you get your letter? I've had mine and I can't get through. So I rang the letter on Friday about, I don't know, 1 o'clock, 1:30. And I was told to ring back on the 29th of January by somebody saying that my cohort wasn't there and the over 80s going to be there, and ring back by the 29th. And then we looked online later on. It was busy in between, and it was still, I couldn't book on. But then I went on to Saturday morning about 12 o'clock, just had another look to see what was happening online. And while we're online, it just popped up to say, oh, no, I would be accepted. So, and we went straight online then, and within 5 minutes I had my appointment, At where I wanted to go was Gamston, because that's my local area, no problems there. But the one thing it also did say, and what it did say, please do not come before your allotted time, and that side of it. So I think that's a message to stop people from queuing. Please do not go early. I get that. And also it did offer me transport if I wanted transport. But from having a bad start, which is what everybody remembers, then the finish was quite good. But also I got my appointment as well for 12 weeks up the road as well. So that now, as far as I am as an individual, and I'm sure it'd be the same for everybody else, that's where they'd be situated today about having received the letter to go for the job or the vaccination. So that's my personal experience on. But initially, my personal experience wasn't good, but then it turned out within 24 hours to correct itself. Unfortunately, the first bit is the bit I remember, not the second bit, as far as Joe Public's concerned.
Okay,
So
thanks.
Anyhow, that's a personal experience, Sarah, and that's out there now. And if you take that back, if you can avoid repeating those exercises, the PR of what we're doing, and everybody's trying so hard to do well, will sort of go away, and Joe Public out there will have a better view of what's happening in a more positive manner, instead of, because everybody's just wound up about it all the time, as the jobs and over 80s and underperforming and not enough vaccine and all the rest of it. I mean, that you get that every time everybody talks to me about it. This is what they relate to me, and if we can turn that round and then we get on, and I'm sure by the middle of February and March, if you can keep on top of your supply, because I understand the supply is the biggest problem and the manufacturing stays up and keeps the supply coming through, then we should be in a better place come February, March. And thanks for the support and for the help. And if I've got any backlog of my jobs, I'll let you know.
Thank you.
I'll just bring Sarah in, but again, I can't emphasise this enough. The sophistication of the National Health Service in this country is spectacular. The fact that we're way ahead of every other developed country, and obviously there are some things, and people have highlighted them today, that we're not happy with. But in other countries, I mean, France in particular, they've vaccinated 8 people. You know, I mean, and that's an exaggeration, obviously, but some other developed countries are nowhere near as well ahead. And this speaks to the strength of the National Health Service that I think we're all proud of. People have highlighted some things that are frustrating, and Reg has brought one up, and I know my own mother had a similar situation. And it's those kind of things I think that actually perhaps take away from the more positive picture that we've got to give people. So, Sarah, was there anything you wanted to mention about what Reg has just said there, or was that a residue here?
Yes, thanks, Councillor Knight. I suppose 2 things. One is I mentioned in my briefing that on Friday afternoon we had to make a decision to suspend offering appointments to the over 75s because of a vaccine supply issue that was completely out of our control. We worked very hard overnight and into Saturday morning, which is why I'm pleased to say that Councillor Adair was able to then access an appointment by lunchtime on Saturday. So it was a less than 24-hour suspension of being able to book appointments. What we had to do was focus on our over 80s and our care homes. All of our plans are subject to vaccine availability, and that you're absolutely right, Councillor Knight, that is always going to be the single biggest challenge. And it is one of those challenges. We don't want to cancel people. We don't want to have to rearrange people's appointments. And we certainly don't want to have to suspend the booking of appointments. We just need to ensure that we get the right level of vaccine to meet our capacity. Because in Nottingham and Nottinghamshire, we certainly have all of the capacity required to vaccinate everybody in a very, very timely manner. We have to match that capacity to that supply.
Okay, thank you very much. I think we've given that a good go now, so I'm going to move on to the vote. Joe, we do have to have this recorded again.
Thank you, Chairman. Councillor Adair.
4.
Councillor Bosniak.
4.
Councillor Bradley.
4.
Councillor Kurtz.
4.
Councillor Garner.
4.
Councillor Knight.
4.
Councillor Payne.
4.
Councillor Rhodes
4.
and Councillor Zadrozny.
4.
Thank you. That's carried unanimously.
Okay, thank you very much for that, and thank you to the 2 officers there. That we really appreciate you coming and keeping us informed. Thank you for that, and we hope to see more positive results in the league table, so to speak. We're going to hold you to it, of course. You know that, don't you?
Oh, we'll certainly deliver it then, Councillor Knight.
Thank you very much. Thank you. So we're now on to agenda item 6, which is the asymptomatic testing in the community. Ros, I think you're leading on this, are you?
Good morning, Chair. Yes, thank you. So my name is Ros Howie. I'm the Programme Director for the COVID response for both Nottinghamshire Council and the City Council. I started in this role the second week of December. You will have received, I'm sure, in your pack a report which was produced by Jonathan. And the purpose of the document was to describe the deployment of asymptomatic testing in community settings. You may well be aware, prior to Christmas, only Tier 3 local authorities were asked to express an interest, and we submitted ours just after Christmas. On the 10th of January, the Secretary of State for Health and Social Care announced that targeted testing will be expanded across England, and all local authorities would be encouraged to target testing to people who can't work from home during lockdown. Now, obviously, you've heard all of the information around vaccines. That has to be our priority. However, we are getting a very strong steer from the government that we're to continue with asymptomatic testing in targeted communities. So I'm not going to go into detail in the report because I'm making the assumption that you would have had the opportunity to have read it. However, the report describes how supplementary asymptomatic testing fits with other methods to control COVID. It identifies lateral flow tests as a new technology. It describes our plans, and it highlights lessons emerging from other areas. And I think I want to take this opportunity just to give you an update on where we are in terms of setting up the sites. So last Wednesday, we went live with the Nogley Leisure Centre in Hyson Green Forest Fields. Tomorrow, we go live with Oak Tree Leisure Centre in Mansfield. And on Thursday, we go live with Mansfield Football Club. The following week, we go live in Manton Worksop. And a week after, we go live in Sandy Lane in Worksop. So that's where we are up to in terms of the community testing. In addition to that, we go live in London Road Hostel with Framework, testing staff and residents. We go live today with a view to expanding into other vulnerable settings. So if it's successful in London Road, we'll be expanding to Potter Street, which is in Worksop, which is another homeless hostel, and we're looking at other vulnerable settings where we can expand asymptomatic testing. We're also just undertaking a prioritisation exercise with key workers and rolling out LFTs to our key workers. There'll be a couple of options there. If the workforce is big enough, we will try and roll it out within their own settings. Otherwise, we'll be directing them to the asymptomatic testing sites that I've just alluded to. And finally, we're engaging with the national programme, rolling out LFTs to key manufacturers across Nottinghamshire. So, for example, Greencore in Worksop went live on the 11th of January, and Bakkavor are going to be starting their LFT testing this week. So I think I just wanted to highlight a couple of aspects and really gain a view about the continued rollout of the community testing. So at the moment, we know that to financially get a balance, we have to do 240 tests a day at the Oak Tree Leisure Centre. Early days at Genogly is showing that we are way short of that. And certainly Wednesday we had 86 tests. We need 275 to break even. Thursday we had 83, Friday 86 and Saturday 29, but we did do a shorter day. Now we are doing some really, really targeted comms, and I'm actually really quite positive about Oak Tree Leisure Centre because it's right next door to a massive Tesco's. And I think that we can definitely encourage staff and shoppers to attend that site. Now, we have had assurance from the Secretary of State through the central finance team that any costs incurred that are deemed reasonable will be covered. And certainly the conversation with Anthony and Jonathan is that if the value of undertaking this and accessing our hard to reach groups and case finding and reducing transmission outweighs the financial element of it, then we should absolutely continue to roll this out. So I'm going to pause there. I did just want to pick up on the queues. We are operating on a drop-in system. We have not introduced a booking system yet. We have the options of expanding the days if we need to, and we will take a formative evaluatory approach and we look at numbers every day. If we have to, we will introduce a booking system, but we don't think we will have to start off with, but it's something that we will certainly keep an eye out on. So I will pause there and ask if there's any questions.
Okay, thank you, Ros. Before that, I'm just going to formally move the recommendations on page 17. Can I have a seconder, please?
Yeah, second that and reserve me right.
Thank you, Reg. So I've got several members who want to speak. I'll take one at a time. Alan, please.
Yes, thanks, Chair, and thank you, Ros, for your report. I just want to ask a question on paragraph 14 of the report, which is the locally driven deployment by Nottinghamshire County and testing in communities, and two communities in not in the area I represent, but certainly in Worksop, where I live, and I do represent an area of Worksop. Manton and Sandy Lane have been chosen. Pleased to see that they are two certainly financially disadvantaged areas with a large number of social housing or private rented properties. They are a transient community in some cases, particularly the Sandy Lane community, and also there are a large number of European migrants living in both Manton and in Sandy Lane who work in the large food processing and distribution centres in Worksop, in the Worksop area predominantly. Now the question arose because, and you talked about targeted comms, Ros, during your report. Are we communicating with these communities in their own language, or are we assuming that English is the first language for all of these people? Because it quite patently would not be to anyone who knew anything about the residents of many of the residents of those areas. So I just want some assurance that we are recognising that English may not be the first language, and that we need to communicate in more than one language to ensure that we don't end up with confusion and a lack of engagement as a result. Thank you.
Thank you, Councillor. So just to reassure you, we're working very closely with the district and borough council communications teams who know their community significantly better than I would know them. And Jonathan was on our project management meeting this morning. He's your comms lead in Bassett Law, and absolutely will make sure that this is translated. So to give you Genogly's view, the leaflets have all been translated into 17 different languages. So we're absolutely cognizant of the different groups and communities that we need to target. So yes, that's been picked up. Thank you.
Thank you, Chairman. That's very helpful.
Okay, I've got several members. I just want to ask a question myself, if you don't mind, Ros, while I remember it. You said you were operating a drop-in system rather than an appointment system. I'm not convinced by that. Are you sure that's not a template for chaos, or at the very least is inefficient? Surely you're going to get people, if you have a drop-in system, most people in my experience want to drop in roughly at the same time. You're going to get overcapacity in queues at certain sections of the day and absolutely no capacity. It's going to be underperforming at other sections of the day. Would it not be better to use an appointment system? That's just a thought off the top of my head, because you did say that the numbers were slightly disappointing. Is that not down to the system rather than the fact that, you know, people aren't aware of it?
Yeah, thank you, Councillor. We did take some advice on this, and we have tried to learn the lessons from other community sites who have also set these up. So we've tried to learn lessons from Liverpool, Merthyr Tydfil, Swadlincote in Derbyshire, Lincoln, all of whom have set them up. We've heard mixed messages, and we did seek advice on whether to bring in a booking system. The view was that the booking system will be incredibly expensive and quite complex to set up in the first instance. We wanted to get asymptomatic testing out as quickly as possible to our communities. And our view is that we will monitor it, and if necessary, we will put it in.
Okay, I understand. Joyce?
Yeah, thank you, Ros, for that information. You've almost answered the questions that I'd got, the queries that I'd got anyway. The thing that I was interested in is, first and foremost, to go on from what you've just said, John, about the need to get the message out there, and is it advisable if you can't cope with the response? Because one of your best assets, I think, is the county councillors that you have, because we all have web pages, we're all on social media. We can certainly encourage people to get into the drop-in centres if you can manage it. So I'd like some sort of early heads up about when these sites are opening in terms of community testing. But I'd also like a heads up on when we have the vaccines centres opened up, because although Sarah mentioned a soft launch over the weekend, it was so soft I didn't know about it until I heard about it on the news this morning. But thank you, Anthony, for giving me a bit of a heads up over the weekend. The thing. So don't forget, your greatest assets are not just the district council, as in terms of a partner, but your best asset is county councillors and district councillors on the ground who can get the message out. And I'm glad to hear you said about you considering a rollout, because we all as elected members could say that we represent areas that are not dissimilar to Bellamy Road in Mansfield and Sandy Lane in Worksop, etc. So I'm looking forward to that rollout. Just keep me informed, please. And then the only question, and I did raise this with Jonathan, was about on paragraph 10, where it talks about wastewater epidemiology. And I just wondered whether you'd like to say a little bit more about that. Because immediately I thought, oh my word, are they putting something in the water? And that's the kind of crazy notion that some of these skeptics would come up with. So just give me something around that, please, Ros.
Thank you, Councillor. So there were a few bits there. I know that the county comms team sent a stakeholder briefing detailing the community testing sites. And I know that one of the things that I asked to go on the briefing was what we could really do from councillors is absolutely their connections and their ability to reach the communities through their own ways of communicating. And I'm happy to share the opening times of all of the sites with this group straight afterwards. In terms of the wastewater epidemiology, so I was quite excited about this, which is, I think, a little bit sad, I think. However, it's a way of testing wastewater, both in communities, but also as targeted as specific sites, such as Backavor, Greencore. So there's been a bit of a delay around it because I think that the lead at the centre got embroiled with all of the Kent lorry drivers over the Christmas period. And I know that they've just brought in a new project manager. And I've got a meeting with Mandy Charles from the city and Dawn to start to look at how we might identify using wastewater epidemiology. So one of the things that I would like to see is we know that we're targeting areas of high prevalence and low testing rates. I think it would be really good to triangulate the information with the wastewater epidemiology, because I think what that will show us is how well we're targeting our comms strategy for the asymptomatic testing sites. Because if we get a high prevalence in the wastewater, but we still have very low testing rates, we know that our strategy is not quite as robust as it could be. So I should have been at a presentation about wastewater testing this morning. I'm hoping that Mandy Clarkson will have gone to that for me instead, but hopefully I'll have a little bit more information after that presentation.
Okay.
I find it fascinating as well, Ross, so I must be a bit, thank you.
Yeah, I mean, in America, of course, you'd have QAnon saying, and they're putting stuff in your water. That's what it would be. So, Ben, on to you.
Thank you, Chair. Touching on Councillor Bosniak's questions, really, perhaps a little bit further kind of clarity. There's a bit of a juxtaposition there between this idea of targeted comms and then needing to hit the numbers. So I wonder, just to be totally clear with all of us, following what Joyce has said, do you want this to be widely advertised and encouraging everybody to come, or is it a targeted programme? And the second part, slightly differently, is obviously these pilot schemes. We need to assess whether they work or not. I think the answer to the cost effectiveness question, do we want to spend the money, is as yet unknown. But for our benefit in terms of that assessment, what is it exactly we're looking for? Because on the one hand, you talked about efficacy there in terms of, does it match up with what we're seeing in other places, wastewater and whatever? Are we getting the right number of tests? But are we doing well if we're getting lots of positive tests, or actually are we looking for lots of negative tests because we're hoping we're moving out of that kind of phase of the virus? What exactly is it that we need to assess in terms of whether it's working or not?
Yeah, I think that's a really good question, because I was confused about this as well. I wasn't entirely sure how you graded this. As obviously it's costing money and it's costing resources that, some would argue might be better placed elsewhere. I wasn't sure how you graded this as a success or not, what parameters you were using, and Ben's highlighted that very well. So, what is a success for the actual scheme, would you say?
I'd flag also, if I may, Chair, just that because Jonathan, I think in particular, was quite sceptical about this in the first place, and wasn't sure as to the benefit. So it'd be good to just know clearly exactly what it is.
Yeah, that's true. Thank you, Ros.
So I'll just cover off, hopefully, Ben, a few of your points, and if you might just pick up on me if I don't cover all of the points that you've raised. So just in terms of that comms piece, I think that there is a balance to strike. Certainly, we have already had conversations in Genogly about expanding the communications beyond just Hyson Green and Forest Fields. And that expansion of communications in the first instance will be around the city, but it will also be broader than that, because at the end of the day, we're trying to target people who are not able to work from home. So it may well be that we've got people from the county that are actually having to go into the city to continue to work, in which case we'd like to target them. And indeed, any of our key workers, and there are a lot, if we can target them and put them in touch with the asymptomatic sites, it's a good way of testing our workforce as well. So I think that there is something for me about, we are undertaking a formative evaluation. If we find that our numbers are extremely low, then I think we need to change our strategy and how we communicate broader, and also how we communicate with that targeted community. Just in terms of the evaluation, I've just managed to secure 3 days a week with the Academic Health Science Network, and I've got 4 hours a week of university time to do a formative evaluation. We've chosen the university in part because they're already evaluating Lincoln and also Derbyshire's testing regime. I think you're absolutely right. I think there is a real anxiety about introducing lateral flow tests and the fact that it tends to throw up, it tends to be quite accurate in terms of positivity, but it isn't so accurate. It tends to throw up a lot of false negatives. And I think that there was a real anxiety about that. And of course, we can't use LFTs to release people, which would be great, wouldn't it? Because we could say you've got a negative LFT, you can go out into the world. But our success is about case finding and reducing transmission. And that is what we're going to be evaluating. We do have some other questions about who are we targeting, where do they live, where do they work, what do they do? So we have got some additional questions, but the majority of this is about case finding.
Okay. I'm still not convinced I understand how you gauge whether it's been a success or not, but that could be my stupidity. Ben?
Yeah, I guess it strikes me, just to get it straight in my own head, effectively it seems like if what we're after is almost, whilst rates stay as low as possible, as many positive tests as possible, so we can ensure that those people isolate and therefore break that kind of chain of transmission. That seems to be the logic. How you assess that, God only knows, so good luck with that. And I hope that goes well. It'll be interesting to hear the feedback. In terms of the messaging, trying to figure out really for those of us on the call and for colleagues what to take away to tell people. Would you agree that it seems something like, if you are living and working in a community near one of those testing sites, then that is the group of people that we're targeting. So, take the Mansfield sites. We're not going come from far and wide across Mansfield, but if you live or work around, or even if you're going shopping at that Tesco, if you're there anyway, pop in and use it. Is that the kind of message?
Absolutely. Yeah. Absolutely.
Okay. Great, thank you.
Dawn, did you want to come in?
Thank you, Chair. It was just to bring in a couple of comments from the public health perspective on the value of community testing. As I think was referenced earlier, there was you're quite correct, a high degree of scepticism about this tool of asymptomatic testing, rapid testing, particularly in December before Christmas. So the facts on the ground that have changed since then are the very much increased prevalence within the community and the emergence of the new variant strain, which is spreading rapidly across the country. So in light of those two factors, I think our public health view locally is that this is something that is certainly worthwhile rolling out to communities, and it's certainly worthwhile rolling out in a targeted manner, particularly in the areas where we think that testing uptake may be lower, but we know from experience that there has been a degree of community transmission in those communities. I think there were just two other points that I wanted to raise from the public health perspective that were of importance for community testing. One is that it is really vitally important that members of the public who come for this testing are asymptomatic. They don't have any symptoms. So we have a separate testing sites for symptomatic individuals, and that's a message that I'm sure Ros would agree. We want to ensure when comms are going out through your networks, that this is very much asymptomatic testing. We certainly wouldn't want a situation where those with symptoms are mingling with those who don't have them. That would not be a good public health result for us. The other aspect that I wanted to highlight, so Ros was completely right and correct on the success factors would be us finding more cases of asymptomatic transmission and reducing transmission within those communities. An additional success factor for me is that we've particularly noted communities that may need support to self-isolate. So these are communities that we think may not want to come forward for testing because they're concerned about their jobs, their livelihood. So a big part of the offer is ensuring that individuals who need to self-isolate is linking them up with all of the local support that we have available to make sure that they feel able and well supported to self-isolate. So that's a success factor for me, and that's something I would like to be communicated alongside the offer of testing, is that, you know, we will link you into the support that's available. Thank you very much, Chair.
Yep. Okay. Thank you very much. I mean, the only other concern I've got, and I don't mean to be patronising about this, but I mean, even the term asymptomatic is perhaps a little bit sophisticated. You're trying to get to people whose first language often isn't even English. I mean, I struggle with that word. I had to practice it 5 times this morning. And the concept behind it, which I understand, are you sure that that's not a problem in itself? And could you not think of something that's perhaps a little bit more easy to comprehend to people? I mean, that may be why you're not getting the amount of people that you're thinking you wanted to get. It's just a thought off the top. It may be complete baloney, but I mean, you know, the people that you're trying to reach often are vulnerable, or they're not educated in English as the first language. Asymptomatic testing needs to be explained to people before they know even what it is that you're talking about. That's
you're right, Chair. Communication is crucial. Right.
Okay, but I mean, that's just our 2 penny worth. We throw that out there. Is there anything that anybody else has got to add? Reg, did you want to say?
No, but I agree with you on the symptomatic testing.
Yeah,
I brought that up with Jonathan when he first came out with it. I said you should have a proper definition for it, because people ask me how do you explain it. It's very, very difficult to explain it to somebody, to say, oh, you mustn't have any symptoms before you go for your test. And I said, well, why would I go for a test if I don't have any symptoms?
Yeah.
So it's a difficult one.
Yeah. Okay, but thank you for that. So unless anybody else has got any other questions or comments, I'm going to move to the vote then, please, Joe.
Thank you, Chair. Councillor Adair.
4.
Councillor Bosniak.
4.
Councillor Bradley.
4.
Councillor Cutts.
4.
Councillor Garner.
4.
Councillor Knight.
4.
Councillor Payne.
4.
Councillor Rhodes.
4.
And Councillor Zadrozny.
4.
Thank you. That's carried unanimously.
Good. Thank you very much. And thanks for that, Ros.
Thank you.
We're on to number 7 now, which is the COVID-19 update. I think, Derek, this is you. Is that correct? Okay, Derek.
Thank you, Chairman. Good morning, members. I'll be brief. I'm conscious of time. This report is the latest in a series of reports that we brought to the Resilience, Recovery and Renewal Committee that really sets out the County Council's response and our ongoing response to the current pandemic. It's structured in a way that you'll be familiar with now, covering the 4 or 5 main work streams that we've got across the County Council that cover our response, our support for vulnerable adults, our support for vulnerable children and families, including our schools and education response, our community support and resilience response, our support for business and the local economy, and of course there's a further report on that specific issue to come today, and our overall corporate resilience as well. This report, as ever, is quite detailed and covers off a whole range of different issues that the County Council has picked up on over the last few weeks since the previous committee. And I, along with other members, other senior colleagues rather, are more than happy to take any questions that members may have.
Great. Thank you very much for that, Derek. I'm going to formally move the recommendations on page 29. I can ask for a seconder, please.
Second that and reserve the right.
Thank you very much, Reg. I'm going to ask for your views and questions now, members, if you've got any to Derek. Alan?
Chairman, I don't have any questions on what is actually a very good report, but one of the recommendations is that we approve and endorse the continued efforts of services to ensure effective service provision. Actually, I think we should register our thanks to our colleagues at every level in the county council, from the most senior to the most junior level, because I think there's some tremendous work being undertaken at the moment to ensure that these sometimes vital services are continuing to be delivered in the most difficult of circumstances. So that's the only comment I'd make at this point, Chair, on this report.
Yeah, I'm sure everybody seconds that, Alan. Thank you very much. Any other question? Kay?
Yes, I just want to say thank you as well, because this weekend or this last week, we've had quite a lot of challenges across the county, flooding in the middle part of the week, and then towards the end of the week, snow, particularly in the southern half of the county. We've had outstanding service from our teams in keeping the roads gritted to keep us up to date. As always, we need more traffic to make the salt and grit work so well on the roads, and we're in for another freeze tonight. But on top of that, we've had an evacuation of a care home as well, where the floodwater was coming up. So it has been a very, very challenging week. And on top of an epidemic as well, I think everybody deserves, all the praise there is, because it has been a team effort across the council, right from the chief executive across the council. So I'd like to say thank you very much as well. And also thank you for the interesting debate on this committee this morning. Thank you. Thanks,
Kate. Anybody else, or I'll move to the vote. Reg, did you want to add anything?
No, just thanks, as everybody else done. I mean, we all agree that the service we're given to the community at the moment, and the difficult times that we're in, is excellent. So, and unfortunately, that's what the community expects from us as well. So we have to keep on delivering. But apart from that, we'll go to the vote. Yeah.
Thanks, Reg. Joe, would you like to read the names, please?
Thank you, Chairman. Councillor Adair.
4.
Councillor Bosniak. 4. Councillor Bradley.
4.
Councillor Cutts.
4.
Councillor Garner.
4.
Councillor Knight.
4.
Councillor Payne.
4.
Councillor Rhodes.
4.
And Councillor Zadrosny.
4.
Thank you. That too is carried unanimously.
Okay, thank you very much for that, colleagues. And we're on to the final agenda item, which is the progress on the Economic Recovery Action Plan. Matt, do you want to introduce this, please?
Thank you, Chair. So the report has been brought back to committee. This is the Economic Recovery Action Plan that was approved by this committee in September 2020. And it also introduces the committee to the D2N2 Vision for Recovery and Growth. Key points to flag in the report are that since the launch of the COVID-19 Economic Recovery Action Plan, over £11.4 million approximately of new money has been secured to help stimulate the economy and directly impact residential and business community of Nottinghamshire. A full progress update, as is usual for this, been attached at Appendix A. Some key highlights to flag in the plan are that work progresses and continues in relation to our residents and our businesses accessing superfast internet speeds. We've also worked on the Warm Homes Hub programme, and that's being rolled out across the county. Likewise, we've secured £1 million to help our residents retrofit homes with some works in relation to insulation and low carbon heating. We've launched our employment and skills portal. We're supporting employment through further apprenticeships with a focus on our looked after children, our care leavers and other vulnerable groups. And our business advisors continue to engage with Nottinghamshire's businesses as we go through the pandemic. We've also highlighted within the report some information in respect of the D2N2. So the key highlights from the D2N2 Economic Recovery Action Plan as well is around unlocking expertise, creativity, political backing to make a move to a zero carbon economy. And we've provided a link for members to have a look into that report as well. There are 2 recommendations in the report for members' consideration. Thank you.
Thanks, Matt. I'll move those on page 34. Can I have a seconder, please?
Yeah, a second those and reserves the right.
Okay, I'll invite it to questions and comments, please? Joyce? You're breaking up, Joyce. We can't hear you.
She's muted.
It muted itself. I don't know how that happened. I'm not sure I should have... No, it wasn't me. I'm not sure whether I should have declared an interest on this, because my question is in regards to the Linders development. And, you know, excuse my ignorance, I'm on Action the Council and its partners, number 6. And it's the very last bullet point where it talks about the 3.6 million investment in North Nottinghamshire and the Linders development in Mansfield about 5G. Matthew, just explain that to me, what it actually means. And would this have any relevance to my Wi-Fi continually breaking up because we don't yet have 5G at Linders? I'm not in the Linders development, but it is on my doorstep. So I just wonder whether there is any impact, that's all.
Is this about your broadband?
Pay for a decent system.
Yeah. Can you answer that vital question about Joyce's broadband connection?
But it is true, because if it's impacting on me,
yeah, of course, I understand.
It's not just the Linders development that's affected by this; it's wider.
Yeah.
Give it a go, Matthew.
I'm sorry, Councillor Bosniak, I can't talk specifically about your broadband connection, but I will endeavour to find out. Effectively, it's around the infrastructure required for 5G as part of the wider development, and in terms of the housing development there. So in effect, that's helping with the digital enablement of not just the housing, but also the employment that will be at the site as well. So that's part of the bid that we put into the for the Getting Building Fund with the LEP.
Right. Thank you.
Alan.
Sorry, Chair. I had nothing further to add. I hadn't realised I'd indicated.
Your broadband's okay, is it, Alan?
It's marvellous, thank you. Yes, but of course, we don't live in Mansfield. We live in Worksop.
Yeah.
You know, not saying too much about that.
Anybody else with any questions? No. Matt, did you want to add something?
Just to add that we will be bringing a digital paper in terms of the digital innovations to a future policy committee, just for members to be aware.
Okay, thank you. Well, we've not got many meetings left before, well, if the elections go ahead to the election. I did hope that this committee will be dealing more and more with the economic recovery plan. I did think this would be a pivotal part of the committee, but obviously the public health issue is the most vital thing to get over, and that's really gone on longer than we thought it would when we first set up the committee. But as we go into the new year, then hopefully the new committee, whatever that will be, will move more towards the economic recovery action plan and have less concerns about the public health aspect of it. But thank you very much for that, and I'm pleased to see that we have actually garnered that £11.4 million, for which I want to thank the officers for that work. Well done. And Reg, unless you want to say anything, I'm going to move on to the vote.
I just wanted to emphasise that, you know, new money coming in at 11.4 million, as you just said. I think that's, you know, very positive stuff. And if we're going to have economic recovery, we need more of that, and we need to be out there battling for more of that sort of money to bring into our local economy and secure the future going forward from an economic point of view.
Absolutely. Thank you, Reg. Chair, would you like to read out the vote, please?
Thank you. Councillor Adair.
4.
Councillor Bosniak.
4.
Councillor Bradley.
4.
Councillor Cutts.
4.
Councillor Garner.
4.
Councillor Knight.
4.
Councillor Payne.
4.
Councillor Rhodes.
4.
And Councillor Zadrosny.
4.
Thank you. That's carried unanimously.
Okay, thank you very much. So there's only the work programme left. We don't need a vote on that, and I'm just assuming that I'll say the same thing. If you want anything to go onto the work programme, just let me know and I'll put it on there. But other than that, it was a very good meeting. I'd like to thank officers and members for some very constructive points they've made today and some good clarifications. With that, I'll say thank you very much, and I'll leave you to your day. Thank you.
Yeah. Bye all.
We get a weather update at 11 o'clock from the Met Office through to our gritting controller at Newark. He'll relay that message to the 4 foremen, which I'm one of, and then we relay that down to our crew that we are in charge of. That'll give you the time that we're supposed to be in the yard, the spread rate that we're supposed to be spreading at, and the weather forecast and what they're expecting and what time we're going out due to the weather. We go out with a said lorry full of salt, could be up to 10-12 tons on the back, and away you go. You spread it down, and you want to be putting it down a couple of hours at least before the forecast of it's going to drop cold to help the traffic crush it down into the tarmac. And then hopefully when it goes freezing, it'll not freeze, it just moistens it up again nicely. It's all down to the weight of the traffic and everything else. It's quite a pleasure to be out there. You know you're doing the best that you can. You're putting the salt out there. You're trying to make the roads safe. You're just in your own little world. You know what you've got to do. You put the radio on, heater's nice and warm, and you're away and enjoying it, and off you go. It's peaceful.